Hi, I'm Alistair Cook, a scientist based at the University of Western Australia in Perth. Our team, part of the National Centre for Asbestos-related Diseases, are running a number of early-phase clinical trials with mesothelioma patients, focusing on different aspects of immunotherapy. Tumours are generally very good at hiding from the immune system and evading attack from the body's own defences, and what immunotherapy aims to do is give a patient's immune cells a much better ability to recognise and destroy tumours. Some existing chemotherapies, although not particularly effective at providing cures, have been found to kill tumour cells in such a way that the immune system can recognise and remember what the cancerous cells look like. Our studies have tried to use this to an advantage in combination with immunotherapies that could prolong or accentuate these low-level immune responses. In two very recent clinical studies, we looked at changes in the types of immune cells in which we would like to induce beneficial cancer-fighting abilities. When we looked at our data, it became very apparent that a commonly used steroid called dexamethasone was having a massive impact on these cells. Dexamethasone is given to patients just prior to the common chemotherapy used in this study for control of skin rashes and other inflammatory side effects. Upon closer inspection, we saw that dexamethasone treatment was reducing the number of T cells, a key player in the adaptive immune response, by more than half. Some T cell subsets were affected more than others, and when we looked at the proportion of cells that were undergoing cell division, we saw that a subset known as regulatory T cells were becoming activated and multiplying far quicker than the other T cells. These regulatory T cells are key players in cancer immunology, as they can be attracted to the location of tumours and are known to dampen down anti-tumour immune responses. As a follow-up, we'd like to study the role of dexamethasone more closely, as the implication from this work is that there may be an impact on the effectiveness of immunotherapy treatments. Dexamethasones are routinely prescribed by oncologists to treat a wide range of chemotherapy-related effects such as fatigue, night sweats, and to stimulate appetite of patients. It's also given for brain metastases and to reduce swelling related to the central nervous system tumours. Because it's so widely used, it'll be important to optimise both dosage and timing in order to minimise any potentially negative outcomes on any immunotherapy treatments under development, and also to include this pre-medication in a number of preclinical mouse models to better reflect and inform subsequent clinical studies.